What if the age of HIV were over? What if everyone made treatment and prevention a priority? If everyone knew their status? If we came together to silence the stigma around HIV? This is what we live for. We live to innovate new therapies, working relentlessly to help people live longer, healthier lives. We stand side by side with the community, educating, advocating, not stopping until everyone is free from HIV. This is what we live for. We live for a day without fear, a day without stigma, the day when HIV is in the past, a day that's getting closer. This is what we live for. For the scientists who make discoveries. We live for everyone with HIV, for everyone who loves them, for the healthcare providers who care for them. All of this is what we live for.
And I am the Chief Operating Officer for the Colorado Health Network. I want to welcome you to the 10th Annual Women and Girls HIV Awareness Day hosted by the Southern Colorado Health Network. While we find ourselves in the virtual realm today, the Southern Colorado Health Network has offices in Colorado Springs and Pueblo. And we acknowledge the Indigenous people as the traditional stewards of this land and the enduring relationship that exists between them and their traditional territories. The land on which I sit today is the unceded territory of the Ute peoples. The earliest documented peoples also include the Apache, Arapaho, Comanche, and Cheyenne. Throughout the month of March, local, state, tribal, federal, and national organizations come together to shed light on the impact of HIV on women and girls and to show support for those living with HIV. We are here to raise awareness of HIV among women and to provide information on access to care. The national theme for this year's event is Let's Stop HIV Together, aimed at the empowerment of communities, partners, and healthcare providers to reduce HIV stigma and promote prevention, testing, and treatment among all people. 1 in 9 women living with HIV are unaware of their HIV status. Knowing your HIV status gives you power to take control of your health. Giving women options that work for them and empower them to take control of their health is what the Colorado Health Network is all about. We offer free HIV testing in a safe and affirming environment. Not only do we provide test results, we engage women in conversations about their sexual health, conversations that empower them to make choices that work for them, for their lives, and for their families. Meeting people where they are at is not just a catchphrase of the staff of the Southern Colorado Health Network. It is the foundation of the services that we provide. We strive to listen and provide options tailored to meet the individual needs of the folks that come to us for care. We recognize and we honor the uniqueness of each individual and the uniqueness of the lives that they live. We believe that to truly empower women in their healthcare journey, we must see her for all that she is, which includes her family, her support systems, the things that she values, and the goals that she has set for herself. Have you heard of U equals U, or undetectable equals untransmittable? This slogan speaks to the fact that people living with HIV who have an undetectable viral load don't transmit HIV to their partners. For those that test positive for HIV, we work with them to find a doctor and to enroll them in health insurance so that money is not a barrier for her to live her life in the confidence that she is undetectable. We provide counseling, including a support group specific for women living with HIV, and a buffet of other services, including dental care, financial assistance for things like rent and utilities, and a supplemental food pantry. Each year, the Southern Colorado Health Network hosts a women's retreat to build support, community, and connection for women living with HIV in the state of Colorado. For those that test negative for the human immunodeficiency virus, we offer support in accessing PrEP, or pre-exposure prophylaxis. PrEP is a daily pill that can reduce a person's risk of getting HIV. For women who feel that they would benefit from this extra layer of protection against HIV, we offer choices for medical care and financial assistance to help her pay for the medications and the associated medical costs of that medication. With routine testing for HIV, access to PrEP, and individually tailored services to help women become and stay undetectable, we can stop HIV together. Thank you for listening, and please visit our website or give us a call to find out more about how we can support you on your healthcare journey, or how you can get involved in supporting the programs and services of the Southern Colorado Health Network.
My name is Betsy Kleiner. I'm an infectious disease doctor here in Colorado Springs, and I hope in 2021 you are protecting yourself from lots of different viruses. Between 2010 and 2017, the rate of new HIV infections in women decreased by 23% overall, and rates in minorities have decreased by 27% in African Americans and 23% in Hispanic and Latinos. These improving trends were seen in women under the age of 55. While our prior interventions are proving to take some traction, it is essential that we continue aggressive education to continue with these successes. It is important that we have good outreach to all women so that women that are living with HIV can get tested, get into care, and get treated effectively, and that we arm women with the knowledge and power to help prevent HIV infections. We know that for women, heterosexual contact continues to be the primary source of new infections, accounting for 85% of cases. African American women continue to account for 57% of new HIV cases in the United States. So why are women more affected by HIV? Some women may be unaware of their male partner's risk factors for HIV, such as injection drug use or having sex with other men, and therefore may not use condoms. Women may be afraid that their partner will leave them or even physically abuse them if they try to talk about condom use. In general, women are less likely to be tested compared to men. We know that unprotected heterosexual sex actually carries a higher risk of infection for the woman compared to the man. And this is for a couple of reasons. One, the vagina has a very large surface area that facilitates more mucosal exposure. Secondly, semen can stay inside the vagina for days, and this facilitates a more protracted time of exposure. In addition, untreated sexually transmitted infections can increase the risk of transmission. So what can women do? Know your status. Get tested, not only for HIV, but for other sexually transmitted infections. Practice safer sex. The first part of practicing safe sex is to talk to your partner before you engage in sex. Open and honest communication promotes healthy relationships. Consider being mutually monogamous. If you have multiple partners, use a condom correctly every single time. Ask your doctor about pre-exposure prophylaxis. Pre-exposure prophylaxis, or PrEP, can help to decrease the risk of contracting HIV by 99% if used consistently and correctly. If you do use drugs, never share needles, straws, or other injection equipment, and bleach your works. If you are HIV positive, see your doctor and get treated. 1 in 9 women do not know they are infected with HIV, and only about half of the women living with HIV remain engaged in care. And of those women that are in care, only 53% have achieved the goal of HIV viral suppression. There's a lot of work that we can do in this arena because we know that getting people that are living with HIV on HIV medicines is not only the best way to help women living with HIV have healthy and productive lives, it also is the best way to decrease new HIV infections. And most importantly, continue to fight the stigma. Talk about HIV, talk about sex. Make these conversations less complicated, less difficult by having conversations with your children, your partners, your parents. That's the only way we continue to make success is by talking about it. So stay safe from all sorts of viruses this 2021 season. Be healthy, and please, if people have questions or concerns, reach out to Colorado Health Network that has all sorts of services for testing and engagement in care for all of us. Thanks.
In this presentation, we'll take a look into the access to healthcare for women and girls living with HIV across the globe. This will include the barriers to care and what is being done globally to improve access to healthcare for women and girls living with HIV. HIV disproportionately affects women and girls. More than half the number of people living with HIV globally are women and girls. This is in large part due to widespread gender inequities that contribute to lowered cultural, social, and economic statuses for women and girls. Reducing the autonomy of women has greatly impacted women's health. Among women and girls living with HIV, women of color and trans women are most disproportionately affected by HIV due to, in large part, higher levels of social, legal, and economic discrimination and marginalization. But what is being done globally to improve access to healthcare for women and girls living with HIV? First, we'll take a look at education. Evidence across the globe shows that increasing access to education for women and girls significantly impacts the community's health, not just for women and girls. Healthy conditions for women can create healthy families and communities. It's been shown that when girls stay in school, they show more favorable sexual and reproductive health outcomes in their lifetime. Sexual health education. Sociocultural norms can contribute to a silencing culture around sex, often discouraging young women and girls from asking questions about sex. Integrating sex-positive programming in schools and healthcare settings can have a positive impact on women's health in the community. If a girl has the autonomy to ask questions about her health, she's more likely to be knowledgeable and get connected with care when she's in need. What does this look like in practice? Currently, this looks like integrating comprehensive sexual health education in school curriculum. This looks like global campaigns to keep girls in school, local educational resource centers for women and girls, and consistent access to sex-positive healthcare providers. In addition to education, decision-making can make a great change in access to healthcare for women and girls living with HIV. To make a significant impact on women and girls living with HIV, women living with HIV must be intentionally involved in the decision-making process. To best create approaches for programs that are women-led, women must be consulted throughout. Recently, women have been occupying positions of power more and more, but only with representation of women living with HIV will communities be able to accurately address their greatest needs. What does decision-making with women-led movements look like? This looks like women in leadership positions in governments. This looks like women leading nonprofit organizations. And this looks like women who are serving as community stakeholders, those who are key in community decision-making. Another key point in access to healthcare for women and girls living with HIV is pertinent policymaking. Policies matter, and policies grounded in gender inequity negatively impact access to care for women and girls living with HIV. Laws currently exist that do not protect women from violence. There are some policies globally that make it difficult for women and girls living with HIV to access healthcare resources. Active policymaking, supporting the autonomy of women, has been imperative to improving women and girls' access to healthcare. In practice, this looks like policies that protect against sexual violence, syringe access programs like Access Point Pueblo, and legislation that increases access to healthcare services. There is a great deal that contributes to the complexities of access to healthcare for women and girls living with HIV. But with efforts that are women-led and women-focused, many organizations across the globe are working tirelessly to combat gender inequality and improve access to healthcare for women and girls.
Hi there, I'm State Representative Danae Esgar. Most recently, I've been promoted to the title of Majority Leader for the State House here in Colorado. It's an honor to serve here, and it's an honor to do the work of the people. Thanks so much for joining for SCHN's 10th Annual Women and Girls Awareness Day. I'm very proud of the work that we've been able to accomplish in connection with SCHN, including the work around modernizing the HIV laws that were in the statute books. This work was so important because there were outdated laws sitting in our books here in the state of Colorado that actually help stigmatize those living with HIV and AIDS, and we really worked hard. And by we, I mean an entire group of activists, of advocates, of legislators, and attorneys to make sure that we modernized those laws to make sure that people living with HIV and AIDS in Colorado can continue to live their fullest life without fear. It's so important to make sure that we got that work done, and it's so important for you all to be joining us here today. Some of you may know that in Colorado, the first case of AIDS was diagnosed in 1982. And by the end of the fourth quarter of 2019, more than 14,500 people were reported to be living with HIV in the state of Colorado. And while the burden of HIV is heaviest in the 5-county metro area, 27% of people living with diagnosed HIV reside outside of these counties, which include southern Colorado. Before I came to the Capitol, I was actually a community organizer and a social activist. Part of my role is as the president of the Southern Colorado Equality Alliance, Pueblo's LGBT advocacy organization, was to be a part of the conversation around what our community was doing to help folks living with HIV and AIDS. That's how I got pulled into this work, and I've never looked back. 57% of people living with HIV as of the end of the year in 2019 were virologically suppressed in the previous 12 months. Women, particularly women of color, are disproportionately affected by HIV. Of the almost 15,000 people living with HIV in Colorado, 13% of those are women, including trans women of color. To decrease the spread of HIV in our communities, it's essential for women to be tested for HIV and to know their status. Pre-exposure prophylaxis, or PrEP as many know it, is a way for women to prevent HIV infection by taking a single pill every single day. We've done a lot of work here at the state capitol to make sure access to PrEP is even more available to more people. Programs like Colorado Health Network's case management, prevention services, and PrEP navigation actually help to ensure women are able to access care, know their status, and prevent transmissions of HIV. Community engagement groups and education, such as Colorado Health Network's SEPA program, work to provide sexual health and HIV education to Latina women in communities throughout Colorado. The ability of legislators, local government, and community organizations to work together is essential to ensure women living with HIV can access care and prevent further infection among women in Colorado. Southern Colorado Health Network has 2 offices located in Pueblo and Colorado Springs. And between those 2 offices, they cover 25 counties throughout Southern Colorado. I'm proud of the work that they've done, and I'm proud to be a part of that work. And I'm proud to be able to continue looking out for folks living with HIV and AIDS every single day here at the state capitol. It's an honor to serve the people of Colorado, and that includes you all. Thanks again for joining, and please don't ever hesitate to reach out and let me know what new work we need to move forward on to help everyone in this state prosper.